thank you for joining us today for this critical panel discussion on human rights in the plastic age, challenges and solutions. As we gather here, we face a pressing global challenge with plastic pollution, as you may know. Today's panel brings together a distinguished group of experts who will delve into the intersection of plastic pollution and human rights. They will explore how plastic waste exacerbates social inequalities, affects health outcomes, and challenges the rights to a clean and safe environment. I would like to thank the permanent missions of Costa Rica, Peru, Bahamas, Sierra Leone, Trinidad and Tobago, and Turkey for cross-sponsoring this event, as well as our esteemed speakers, panelists, and guests for agreeing to engage in this important discussion today. With that, I am honored to not take a lot more time. I am honored to introduce my Ambassador Virginia Alcantara, permanent representative of the Dominican Republic to the United Nations Office and other international organizations in Geneva, who will provide short opening remarks for this important event.
Thank you, Claudia. The invention of plastic first saved the life of many animals, such as elephants and some species of turtles. Then he made life easier for all of us. And in the same way that there is nothing as a free lunch, plastic is now taking a heavy toll on us. The reality that this represents is telling us that the pervasive presence of plastic in our daily life will have to be re-evaluated. And at the same time, find effective remedies to the harmful pollution that the waste of that material is already representing. As we are now in the age of consequences, the celebration of this side event on the topic of human rights in the age of plastic challenges and solutions is relevant. The first problem is that in our life, we have plastic everywhere. Or as we Dominicans say, we even have it in the soup. Literally, it's almost like that. Because in our bed, we use plastic pillows. We brush our teeth with plastic toothbrushes. I typed this intervention on a plastic keyboard, and we drink beverages and eat food in plastic containers. The waste from all that plastic is now generally accepted as contaminating our environment, the oceans, the air, and even our bodies. Microplastics have been found in lungs, and I have read that even in the heart of a person who was undergoing a cardiovascular surgery. Microplastics not only appear polluting the ocean, where they represent more than the 80% of marine waste. There is already plastic pollution in the atmosphere and in areas as remote as high altitude, glacier, the Arctic, the Antarctic. The poles are affected by plastic pollution, and even the highest mountain in our planet, like Mount Everest. If we calculate that most of the plastic particles are fibers from the synthetic fabric of the clothes we wear, we can already imagine how easily microplastics reach the ocean via sewage water. A researcher at the Scripps Institution of Oceanography
at the University of California in San Diego outlined what she thinks is the new big frontier. What are we doing about our waste water treatment and what we make our clothes out of? Because clearly the plastic is washing straight into the ocean. Let's take these two examples as samples. Number one, humans are believed to consume at least 50,000 microplastic particles a year through food and water. And number two, a 2016 study showed that a single wash of clothes can release 700,000 microplastic fibers. With plastic, we have made the journey from human comfort to the impact on the human right to a healthy environment and to representing a threat to the health of the food we eat, the water we drink, and even the air we breathe. Since I am not an expert on the subject, the task that I set for myself when writing this work was the easy task, briefly outlining the reality that we already have in front of our eyes, a gigantic problem whose solution represents a monumental challenge for humanity. Luckily, there are expert people on the panel dedicated to studying the problem in greater depth than mine. Perhaps they can open up paths for us that could lead to answer to the multiple problems that plastic pollution is posing to the world. With that hope, I now close my mouth and pay more attention to my ears. Thank you so much.
Thank you, Ambassador. Now it is my privilege to introduce to you Dr. Marcos Orellana, UN Special Rapporteur on the implications for human rights of the environmentally sound management and disposal of hazardous substances and waste.
Thank you very much, Claudia, for giving me the floor, and thanks to the Dominican Republic for its kind invitation to join this conversation, also the sponsors of this panel. As the ambassador articulated upon the evidence, it has become clear that plastic pollution has become a global threat to the enjoyment of human rights along the whole life cycle of plastics. This is a global environmental justice issue, as for example, countries that have no plastic production or not significant plastic production become inundated with plastic garbage from the marine environment. But it's not only in the marine environment, as we've heard Ambassador articulate, also in rivers, in lakes, and elsewhere. Given the threat to human rights of the whole life cycle of plastics, human rights principles are essential for an equitable, legitimate, and effective response. A human rights-based approach building on scientific evidence, on principles of transparency, accountability, public participation, and non-discrimination is essential. That's where explicit human rights language in the instrument under negotiation is key, in the preamble, in the objectives, in regards to chemicals of concern, just transition, or reporting, or the means of implementation. Rights like the rights to information, the right to development, the right to science, and the right to a clean, healthy, and sustainable environment should find explicit mention in the agreement. But also principles should be reflected in the text. Principle of prevention should be reflected in provisions that reduce plastic production, or in regards to toxic additives added to virgin plastics or resulting from recycling. The polluter pays principle has also implications for taxes on global producers or extended producer responsibility schemes across boundaries. The principle of transparency is key to the disclosure of volumes of production or the disclosure of chemicals that are added to plastics or that are released from plastics. And certainly just transition as a principle places a focus on persons in vulnerable situations. Time is tight, so I thought I'd share a couple of reflections on some negotiating dynamics that we've seen. The first one is delay tactics. It is no secret that because of the climate emergency and the phase out of fossil fuels, this industry is changing, and it is changing into petrochemicals, and the petrochemical industry is trying very hard to avoid any controls in terms of volumes of production or other kinds of control in terms of chemicals that may be added to petrochemical products. And that is where it has become visible that during the negotiations it appears that a number of countries are not negotiating in good faith, and delay tactics are an instrument or a tool to run out the clock so that there's very limited time at the end to take robust decisions. So that's the first observation. The second one is on this tension that has been presented on unanimity, sometimes couched as consensus, or voting. If it had not been for the possibility of voting in the elaboration of the key human rights covenants, we would not have covenants today. And so this emphasis on unanimity, that everybody must agree to every single provision, is going to lead to a paralysis, and it's not going to lead to an effective instrument. And so, will we have votings? Well, it is provided for in the rules of procedure. I understand it's a controversial issue, but it would take a lot of guts for member states to really call for a vote, and even if a vote is called for, that vote to be successful. And so there's a big issue there. And thirdly, some commentators are pointing out that work with a bare bones instrument, a framework convention that could then be developed through decisions by the conferences of the parties. Well, this has been tried in the past, but it has not worked. If we look at the Basel Convention on Transboundary Movements of Hazardous Waste, there was an amendment to ban the export of waste from industrialized countries to developing countries, generally speaking. Well, that amendment as a COP resolution did not work. The treaty had to be amended. So the treaty needs to be gotten right from the start. It cannot be dealt with through COP resolutions. Certainly can be tweaked, but a framework conventions in multilateral negotiations on environment have been used where the science has been incomplete or inadequate, and there has to be a process getting countries to first agree to cooperate, and then when the science becomes more tangible and actionable, can move forward to further concrete obligations. That has been the dynamics of, say, the Montreal Protocol on ozone-depleting substances. But here, the science, what is the uncertainties? Sure, there's always uncertainties in some aspect, but it is very clear that plastics pose a threat to the enjoyment of human rights. I'm out of time, so I will only conclude by pointing out that explicit human rights language has been included in the Paris Agreement, in the coming Montreal Global Biodiversity Framework, in the Global Framework on Chemicals. This is the Plastic Pollution Treaty is another opportunity to continue this progress, avoid linear thinking, avoid siloed thinking, and to solve the global plastic problem at its root and address the legacy of the plastic burden. Thank you very much.
Thank you so much, Dr. Orellana. And certainly, as we approach the last session of negotiation of the plastics agreement, we see that we are facing not only the challenges of the discussions that we have of what's going to be included, but how we have, and as you said in explicit language, we include this protection of the human rights when it comes to plastic and plastic pollution. I would like to briefly introduce my panelists that are here today. I know that many of them are very familiar faces to the people that are involved in plastics negotiation, but nonetheless, today we have Bernardo Roca-Reyros, who is Minister Councilor Deputy Permanent Representative of Peru to the United Nations Office at Geneva, Ana Paula de Souza, Human Rights Officer at the UN Office of the High Commissioner for Human Rights, Jay Monk, Chief Scientific Officer and Managing Director of the Food Packaging Forum, Andres del Castillo, Senior Attorney, Environmental Health Program and Center for International Environmental Law, and Kritika Canillos, Technical Officer, Public Health and Law and Policies Team at the World Health Organization. I thank you all for being here. I don't want this to be a super structured discussion, as the intention of having all these panelists is actually hearing some of the opinions that they have on the process that we're taking forward, and on this topic specifically, as especially we're challenged with having a treaty by the end of the year. So I think that Dr. Orellana posed interesting points in his intervention, and I would like to invite first maybe Bernardo to give us some inputs on what would you see are the key gaps that we are facing to having human rights, having the support of human rights and protection of human rights when it comes to the plastic treaty, and understanding this health environmental impact that plastic pollution has and on human rights.
Thank you, Claudia, and welcome everyone. First of all, it's important to understand that in order to work to effectively reduce and eliminate plastic pollution and mitigate the diverse effects of plastic pollution and pollution on the environment and human health, states will have to take measures that promote and protect human rights, such as the human right to a clean and sustainable environment and the highest attainable standards of health. In that sense, incorporating a human rights perspective into the Treaty on Plastics doesn't just mean that we have to include it in the list of principles or incorporating an article in the text itself. To truly conceive of the plastic treaty in a way that is sensitive to a broad range of relevant human rights, we will need to rethink the full life cycles of plastics from a human rights perspective. First and foremost, plastic pollution is a transboundary problem that cannot be addressed by a single country. As such, it is important that on a multilateral scale, the adverse effects of plastic pollution be widely informed, with the ultimate goal of creating a global consensus through the Plastic Treaty on the fact that pollution, biodiversity loss, and climate change are mutually reinforcing and harm not only the environment, but the ability of all persons to fully enjoy a broad range of human rights, including the right to a clean and healthy and sustainable environment, access to safe and clean drinking water and sanitation, adequate housing, and the highest attainable standard of physical and mental health. Secondly, pollution across the full life cycle of plastics disproportionately impacts those living in vulnerable settings, aggravating existing inequalities. For example, pollution, and specifically plastic pollution, is a disproportionate threat for certain countries or communities that rely on their oceans or ecoterrains to fuel their economies. Similarly, pollution takes on dangerous dimensions in the case of frontline communities and workers at heightened risk of occupational exposure, like waste picker, for example, whose livelihood depends on recycling the plastics, often in unsafe or in toxic conditions. Last but not least, pollution and plastic pollution must be considered from a human rights lens, particularly when analyzing its impact on humans and on women and girls' rights. Numerous studies have been carried out by the UN Environmental Program that have concluded that women and girls are particularly exposed to toxic smoke created by unsafe practice such as burning plastic waste, and are overrepresented in vulnerable and frontline communities such as waste pickers or urban poor. So, in part, the decision to start negotiations leading to a global legally binding instrument to end plastic pollution is a recognition by itself of the need to address the international governance gaps that exist across the full life cycle of plastics and associated chemicals to prevent impacts on human health and environment, which is in essence impacts on human rights. To this end, we need to understand how and to what extent plastics and their associated chemicals adversely affect human rights, and rethink how the new plastic pollution instrument can address plastic, starting from a molecular level, then as a material and a product, and finally as a waste. With tangible and updated research on the linkages between human rights and pollution, states can counter efforts to weaken the human rights approach to the treaty with updates and reliable data during negotiations. This is why, for example, Peru, with a group of countries in the core group, we drafted a decision to task the Human Rights Council Advisory Committee in this forum with studying the human rights implication of the life cycle of plastics. So with this brief reflection, I'm happy to give you back the floor. Thank you.
Thank you, Bernardo, certainly. And I would like to go next with Ana Paula, since you mentioned this, and we're seeing how plastic pollution is undermining several fundamental rights. And I would say, what challenges are we seeing, would you say, Ana Paula, that we're having on having this human rights perspective when it comes to the plastic treaty, or addressing the impacts of plastic pollution on human rights?
I will start like with some facts. Now, the petrochemicals are expected to become the largest driver of global oil demand growth by 2030, and they're expecting that this growth drive is going to come from plastics, because the world is already starting transitioning away from fossil fuels. So we also know that because it's being sold as a cheap solution, currently the total weight of plastics and plastic chemicals exceeds the overall mass of all land and marine animals. We also know that ensuring safety of plastics is impossible, as the rates of appearance in the environment exceeds government capacities to assess risks and control problems. We also know that much of the plastic waste that is exported from the north to the south So this, as the Special Rapporteur has mentioned, is truly a global environmental justice issue. Plastic pollution also touches on every ecosystem on the planet, as the Dominican Republic ambassador has mentioned in its opening remarks. But we also know that this is an issue related to the economic model. The externalities are larger than the economic earnings of the plastic industries. There is a recent study that calculated that in 2015, health-related costs of plastic production exceeded $250 billion globally, and this is not mentioning waste management related costs. There are also estimates that suggest that developing countries, especially low-income countries, despite consuming less plastics, they incur a total lifetime plastic cost that is 10 times higher than developed countries. That makes a huge issue related to the right to development. So as you can see, we are facing huge issues, not only in terms of the industry interests when it comes to but also a lot of attempts to undermine science. And I'm very happy that in this panel, Jane has joined us. She's one of the scientists engaged in the scientist coalition for the plastics treaty, and I don't want to overstep on what she's going to mention, but I think that is critical because there are constant attempts to undermine what science is saying, and science is saying that that plastics is accumulating in food chains, in water, soil, air, and also in our bodies. So closing our eyes to the impact that plastics has, but it's also a substance that is so part of our lives. I don't think that we can go by one day without attempting not to be exposed to plastics, and how this is also impacting our right as consumers to know what we have been exposed. And that comes to an obligation, and I want to draw from what Bernardo has said, that you need to rethink the whole life cycle of plastics through human rights-based approach. And why is that? Because every stage of the life cycle of plastics, starting from extraction, will have implications. And we know that while all of us here have been touched by, I don't think that there is studies saying that there are virtually no human body without without plastics, microplastics in it. So virtually we are all here being affected. We still don't know to what extent, although science is coming in and explaining that this links to obesity, links to diabetes, it links to development problems and so on. But we know that although all here, the plastic, we bear the costs of plastics. There are groups, peoples and individuals that are disproportionately impacted. And I just wanted to make, in closing, acknowledge that Nancy Gonzalez is here. She's a member of the Indigenous Caucus for the INC. And I think not only the indigenous peoples, but also the waste speakers, all the environmental justice movement is being very active at the INC. And I think we will hope that their voices would be the ones truly informing the discussions rather than those that are informed by greed and want to benefit from the status quo as it is. And I will leave them because I know we are short of time.
Thank you, Ana Paula, and certainly, and I like that you mentioned Jane because I was going to go straight to Jane as well.
And I would like to hear, especially from a scientific point, based on what has been said, what would you say are some of the critical recommendations when it comes to policymakers and to negotiators towards the last step of the negotiation, hopefully the last step, to advance its human rights context and perspective in the plastic.
Thank you very much, Gavin, for that question, and thank you very much to the Dominican Republic and the co-sponsors for inviting me to be here today to be about. The question you asked me is a little bit slippery terrain for a scientist, because one of the things that we're very adamant, also with the Scientist Coalition for an Effective Plastics Treaty, is not to make policy prescriptive statements. So we don't want to tell you what to do. I think the policymakers are the experts. But I can speak to you from the perspective of a scientist who's been working on plastics and specifically chemicals in plastics for more than 20 years. And I can't stress enough that we know enough science. We know the facts. As Marcos pointed out, and also the other speakers, Ana Paula and others, have said the facts are actually very clear. Plastics are ubiquitous. The way that we are currently extracting fossil carbon from the ground, producing plastics, and using plastics as a very cheap and not true cost material in our global economy is detrimental to human health and to the environment. And I think these are the facts, and that's why we are negotiating the treaty. So I would not like to see data gaps or scientific uncertainty be used as an excuse for delayed action. We need ambitious and very clear assertive decision making. Now, when we move forward with this decision making, I think there are a few aspects to keep in mind. One of them being to avoid regrettable substitutions. So when you have a problem that is so wicked, we say, complex, and has so many different aspects as the plastic pollution problem, we should resist the urge to jump to the quick fix solutions, right? Because usually what happens with these very complex and wicked problems is that if we just kind of focus on one symptom of the problem, like just the waste, for example, and I say just the waste, I know it's a huge aspect, but if we just focus on solving waste by investing into technologies, for example, that will improve waste management, we may create rebound effects. And we may put ourselves into a situation where we have a technological lock-in. For example, we invest into building infrastructure, which costs humongous amounts of money and needs to be amortized over decades and decades. And that locks us into certain specific solutions. So I think we need to be very clear that we've understood all the dimensions of the problem. And the previous speakers have alluded to this very eloquently, saying that we have to address plastic pollution across its entire life cycle, which starts with extraction of fossil carbon. It continues with the production of petrochemicals and plastics, exposure of fence-line communities, which are
unacceptably exposed to these hazardous toxic chemicals, which impact their human rights to health, but also the exposure during the use of plastics, which has maybe not been mentioned yet, and that's an area of expertise that I work on. Whenever we put food and drink into plastics, or we process food and drink with plastic materials processing equipment, the plastic can leach chemicals into the foodstuff. And we actually just 2 days ago published a study showing that there are at least 1,347 plastic chemicals that are known to be associated with food packaging, plastic food packaging, and that are measured in people. And some of these are known to be highly concerning chemicals because they are carcinogenic, mutagenic, or toxic to reproduction. And so that means that in addition to the sort of special communities that are subjected to plastic waste or also subjected to the emissions from processing, almost the entire human population is subjected to plastic chemicals on a daily basis through consumption of packaged foodstuff. And this is already resulting in another infringement on the human right to family. I believe that's human right 16. I looked it up, from the Universal Declaration of Human Rights, published in 1948, that every human being has a right to family. Now, what some of these plastic chemicals are doing is they are affecting the endocrine system, so that's the natural hormone system, and they do this at extremely low levels. And these levels are sometimes even below levels that humans can measure chemicals at. And we are seeing a trend over the last 40, 50 years of declining sperm count worldwide. The entire human population is affected by that, and that's very, very strongly, robustly associated with chemical exposures, for example, phthalates. And this means that if this trend continues by 2040, for example, you will only be able to have a family if you can use artificial reproductive technology, which is extremely expensive and not accessible to everyone. So maybe I will stop with that to not take up more time. But I just wanted to stress that the use phase of plastics affects the entire human population, and that it directly contradicts the human right to family. Thank you very much.
Thank you, Jane. And certainly, yes, we're facing many challenges, and I think it's a bit scary when we start getting even more information on the treaty and the effects of plastic. And every time we discussed a point on the full cycle of plastics, there's always new information that really, at least on our side, impresses me when we start seeing the connection with so many of the challenges that we face when it comes to the human right to health. On that note, I'm going to this side, to Critica, as we can, I would like to see, since we know that during this whole process, we're discussing a lot of human rights to health. Anything that, I think that one of the things that have been very clear is that this is not just an environmental agreement. It has a multi-dimensional aspect, and it touches upon so many critical issues. And I would like to know, Kritika, how could we advance this intersection with plastics and the human right to health, and maybe see how the World Health Organization can see the need for maybe strengthening existing frameworks or mechanisms to integrate them maybe in this negotiation process or the future treaty.
Thank you so much, Fabia, for that question. And that's an interesting one, because thank you for the invitation, of course. When we first went for the first session that happened in Punta del Este, everyone was very intrigued about WHO's participation, and I think health at that point was referenced in the resolution, but was not really being talked about in the way it should have been. And now cut to, the session in Ottawa and what the revised treaty says, you at least see the mentions of health, and we at WHO have, been participating because it truly intersects with so many of our programs of work. Personally, I actually got involved in the negotiation because of my work on tobacco. And, we had done a campaign where we talked about how cigarette filters, are one of the most littered products. And then, they sort of leach into your aquatic system, your marine environment, and have heavy metals, nicotine, and then also have an impact on the right to livelihood of the people when it comes to the fishing. There's also, and the ambassador talked about, this gentleman who was having an operation, and then there was plastics seen in them. So much plastics that is used in healthcare. And we recognize that it is an extremely important material when it comes to syringes, IV bags, personal protective equipment. It's truly revolutionized healthcare. But at the same time, overuse of this material has led to a lot of plastic waste, has harmed the environment, and also potentially impacted human health. Just to give you a statistic, healthcare generates substantial waste, with 85% being non-hazardous but still requiring proper management. And we have been articulating this point that the healthcare sector has to consider its contribution to this plastic waste and balance it out with other steps to take and reduce its footprint. Also, we've had Peru and other member states who brought a resolution last year at the 76th WHA to have a resolution on the impact of animals waste. And we've been working in order to get that scientific certainty, to fill in the gaps of science where they exist. And I completely agree with Jane that that's sort of the other point, that we don't need to wait for that evidence to come for them to take action on this treaty. We have examples from other treaties like the Cartagena Protocol, and of course, very established principle of environment law being the precautionary principle. So there's a lot to be done. We want to see the protection of human health as a core objective and tenet of this treaty. And we're very happy to provide member states with whatever technical assistance that we can. I'll stop there and hand back to you.
Thank you so much. Last but not least, Andres.
I know that at least for those of the plastic negotiations, you know that Andres has always been there and he's always around. But I would like to talk, since we talked about the impacts, not only the environmental growth, but also human health, and we talked about the full cycle of plastics, and so many actors come and being affected in so many different ways when it comes to the full cycle of plastics and contamination during the whole cycle. And I would like to ask you specifically, how do you see how can this multifaceted challenges be addressed through the integrated strategies, that will encompass legal reforms,
innovative policy measures, but also the engagement of diverse stakeholders, which is a topic we've talked about during the negotiations, considering, and I think it is very connected to the fact of protecting human rights when we talk about engaging waste speakers, local communities, indigenous peoples, due to all the effects that we're seeing that plastic pollution has.
This is a very timely event because we are in between a very important decision that was adopted by consensus at the last Human Rights Council on the full life cycle of plastic and one of the last round of negotiation of the plastics treaty, right? So the reflections here will be very important to inform negotiators, but also the human rights community on what is going on and where we are in different processes, right? And as the previous speaker say, this is a multi-phase problem. We call this a roundabout of many problems that we are confronting in plastics, where we have health, environmental, but also one of the aspects to add a layer of complexity that I want to highlight is climate too, right? And we have seen here at the Human Rights Council how climate has been approached because of the specific and direct link that exacerbate human rights abuses and violations. And just to give you some data from the Lawrence Berkeley Laboratory, that is a national laboratory in the US, they predict that with the current trend of production of plastic, with the increased production by 2050, plastic production will consume up to 31% of the remaining carbon budget. This is 1/3 of the carbon budget will be only attributed to the plastic production. And as we have seen, there's already information on how climate affects human rights directly. So we think that this dimension is very important, and that also show us that there are some solutions that can come from other agencies. For instance, at the national level, I can give you an example how in the US there's a specific law that on forced labor prevention of the Uyghur communities in China, and since July this year they updated the sectors that they need to work to make sure that products that are import or companies that are involved with companies working in that part of China don't use forced labor, right? And they include for the first time PVC, that is one type of resin of plastic, as one of the sectors that they need to focus now to see what are the controls that they will use. So this is a specific example of the links between human rights, due diligence, and labor rights, right? And the other example is more on the procedural part, right? That goes to answer the second question. That is the second aspect of human rights that are important, the procedural rights or environmental democracy governance that involve information, participation, and access to remedy and justice. And on this aspect of participation, not only at the international level is important, and we know that there are many stakeholders and right holders that, because they are even direct affected by plastic production, or by plastic waste, or by their salary can be threatened because the instability of their jobs. Right? It's important to highlight here that those people need to be involved since the beginning in the way how we are shaping the global governance of plastics, but also at the national level. And I give an example with something that is a proposed policy option that is called EPR, Extended Producer Responsibilities. And we have some waste speakers that say that they need to be involved at the national level when this kind of policy is on their development, because sometimes what happens with EPR is a side effect, is a privatization of the waste management and of the zone in the cities where private sector will say, this is the part where I will go first and take the valuable plastics, and then after, when I do that, then you can come as waste speaker and pick the rest of the waste, right? That has less or no value. So this is just an example on how that can exacerbate existing problem. Thank you.
Thank you, Andres. And we're very short on time, but to conclude our event, and I would like to mention as well that we have some crops outside waiting for all of you, so it's worth waiting. I am honored to invite Ambassador Cristian Guillermo Fernandez, Permanent Representative of Costa Rica to the United Nations Office at Geneva, to give us some closing remarks. We wanted to have some question and answers, but due to time constraints, I think that we go outside, we can mingle and socialize a bit, and maybe you can get a chance to speak with the panelists. So, to you, Ambassador, thank you
Thank you, Claudia, and thank you, Virgilio, to invite me also for these closing remarks and also to attend this very interesting panel where we have the opportunity to share most of our concerns regarding the plastic pollution. As Ambassador Virgilio said, there is no free lunch, which is we are very happy to also to try to summarize now, which is it's clear that from our standpoint of view, there is an interconnection of two vital and interconnected crises. The plastic pollution on one side and the erosion of human rights. So at least the erosion, as the Volker Turk say, the erosion of the leadership, political leadership to implement human rights, because the system of human rights is not in crisis. It's ourselves and our leaders who are giving not enough space to implement those. Which has been the conversation we had today is remind us also of the gravity of the situation and the urgency with which we must act. The human rights to a clean, healthy and sustainable environment is not just an abstract principle, it's a fundamental right, one that plastic pollution has systematically undermined, impacting the most vulnerable among us, as has been said already here in the panel, children, marginalized communities and small islands, nations, just to name a few. As we look ahead to the upcoming fifth committee with the Intergovernmental Negotiating Committee in Busan, it's critical that we integrate human rights at the core of the forthcoming international legally binding instrument on plastic pollution. This is for me one of the main things I take of this panel. Second, and I think also that doing so is not only a moral obligation, but also an essential tool for achieving a sustainable solution for the plastic crisis. And for that we need to push together for this. Including human rights explicitly in the outcomes of the INC 5 will strengthen international accountability mechanisms and ensure that the instrument is not environmentally sound, but also socially just. And I think this is the link that we need to do since the beginning. The conversations must not only be about the technical approach and solutions, but also among how we empower communities and safeguarding the most vulnerable populations and ensuring also that in the process all their voice and those for most affected are heard in the decision-making process. By framing, now is something that I take also from this panel, is that framing the plastic pollution problem through a human rights-based approach, we can introduce a powerful framework of accountability and action. And this is the most important now. We need to implement all these agreements that we have here in Geneva, New York, Nairobi, or Vienna. My final message to all of you today is that the integration of human rights within the INC 5 negotiation is not a luxury. It's not something that comes from the mind of some brilliant people. It's a necessity. And it will bring clarity, purpose, and urgency to our efforts, ensuring that the future instrument will not only protect our environment, but also uphold the dignity and human rights of all. As we continue on this path, let us also remember that by respecting the right to a clean, healthy, and sustainable development environment, we are safeguarding the future for us and generations to come. Thank you very much, Claudia and Virgilio, for the opportunity.
Once again, thank you to all our co-sponsors for the event, to the ambassadors, and as well to all our speakers for being here today. And thank you all for accompanying us in this panel and discussion. I remind you, we have some lunch outside, some light lunch, and thank you again for being here.